Hi, Dr. Josh Plutzinger here. How is it that you can reverse type 2 diabetes in 6 months or less? Well, the question that we should be asking is, why are you a type 2 diabetic? As a doctor, as a son and a grandson of a type 2 diabetic, and what you know and what you've been going through as a type 2 diabetic, the story is pretty much the same. And so over the years, I've gotten pretty close, pretty friendly with the patients that I work with. And as I go through my doctoring process with them, I understand exactly what their story has been. So if we rewind all the way back to diagnosis day, everybody's story is pretty much the same on how they get diagnosed. Typically, most diabetics go through a process of a routine lab, whether it was for something that was not related to type 2 diabetes or a work fair or an event where they got blood labs taken. Over the next course of the couple of days, you get a phone call from the doctor's office. The office is typically the nurse or it's typically the staff, and it's saying, hey, we want you to come in. The doctor wants to review your labs with you. And typically when you get that call, you know on your side of the phone, it's not a very good call. They're calling you because they want to discuss your blood labs. So you make your appointment, you show up to that appointment with angst, you wait your time in the waiting room, you're finally shuffled back to your room, and you meet with the doctor. And the doctor says, unfortunately, we have some bad news for you. Your A1C was high, your blood sugars are high, you're diagnosed as a type 2 diabetic. And from there on, you are managed with type 2 diabetic drugs, so oral diabetic medications. You're also maybe given the recommendations of, oh, and by the way, you better change your diet, you better exercise, and you better start losing some weight. Now here's the thing, that's the way that most diabetics are treated on diagnosis day, if not treated for the rest of their life. And so now you get on this routine of you have to take your blood sugars, you have to take your medications, and now you have a schedule, a standing schedule with meeting with your doctor. It could be every 3 months, it could be every 6 months, it could be every 9 months. And every time that you go back to see your doctor and you take blood labs, and every time that those labs are not in agreement with the prescribing doctor, guess what? Another medication is prescribed. So you start to get on this merry-go-round of every time that merry-go-round comes around and your labs are not in agreement with the doctor, you're getting prescribed another drug. So it's not uncommon to start seeing diabetics start to take blood pressure drugs and cholesterol drugs and drugs to protect their kidneys and so on. And this process continues and continues and continues to the point that over the next couple of years, maybe that first drug, if it's metformin and it's maxed out at 2,000 milligrams, you're gonna start your next drug therapy sequence, which is going to be a class of drugs called secretagogues, which is designed to stimulate the pancreas to secrete more insulin. So now you're on your second set of oral diabetic medications, and that merry-go-round continues to go around and go around. And by the time you look up, you're on 10 to 12 different medications. And you could ask yourself, is that 12th medication really doing any good? Well, if you continue to get prescribed medications, probably not. And then if you've been in this long enough, you're again to get to the point where either insulin is going to be recommended or injectable insulin is going to be prescribed. And that is the last ditch effort to try and control type 2 diabetes. But here's the thing, you can reverse diabetes. So when you get to the point and when you get fed up, and your doctor is you're going to go to your doctor and you're going to say, I would like anything to reverse type 2 diabetes. And your doctor is going to come back with, it's not possible. And you're like, I've seen the people that I'm close to, they've had the amputations, they've had the cardiovascular disease, they have the weight gain, they can't control their bladder, their health is miserable. They're getting the amputations, they have the neuropathy. What do I have to do to get rid of type 2 diabetes? And again, the answer is going to be, you can't. And I'm here to tell you that you can reverse type 2 diabetes. And what does reversing type 2 diabetes mean? It means that you can get off, reduce, if not eliminate, all prescription medications across the board. And I'm not just talking about your diabetic medications. I'm talking about your blood pressure medications, your statins, your drugs for pain, your drugs for this, your drugs for your kidneys, your drugs for whatever it is that you continue to be prescribed. The second thing is you can lose weight without exercising. What does that mean? If you just put your skepticism aside for a second and you understand that when you start doing the things that you need to do in order to reverse your type 2 diabetes, the weight is going to come off. Most people aren't well enough to start exercising, and as I talk to you moving forward in these videos, I will demonstrate why exercise is a problematic recommendation for most type 2 diabetes initially trying to get out of their situation. You can regain your energy. You can arrest and eliminate the progression of your diabetic complications, diabetic neuropathies, nerve pain, nephropathy, okay, phase 1, phase 2, phase 3 kidney failure, okay, retinopathy, the failure of your eyesight, deafness, cardiovascular disease. These are all stoppable and reversible processes. And ultimately, what we want to do is we want to demonstrate objectively on the black and white tests, on the paper itself, that you're reversing type 2 diabetes. Because the only thing that you're being managed for right now is your A1C and your glucose levels. And when that happens, you're being diagnosed and treated like everyone else that has type 2 diabetes. And that is at the surface. So we have to find out why you have the inability to regulate your own blood sugar, which is only second primitively to breathing oxygen to live. So once we start this process, we have to find out first and foremost why you're a diabetic. And in the next video, I will explain and show you how that process works. We'll see you in the next video.